Yesterday, the South African Institute of International Affairs, or SAIIA, held a cross-continental webinar discussing the socio-economic impact of COVID-19 in both Africa and Latin American countries. The dialogue focused on health and socio-economic responses at a domestic level in these countries. And since the outbreak of the coronavirus, there's been speculation that developing economies will experience the worst impact in comparison to developed countries, and that Africa and its ailing healthcare system are expected to fall apart. Panellists from South Africa, Brazil, Nigeria and Mexico chaired this meeting. SAIIA's Chief Executive, Elizabeth Sidiropoulos, joins us now via Skype to talk more about what came out of that webinar. Thanks so much for your time this morning, Elizabeth. Welcome to Morning Live.
Good morning. Thank you.
Now, the South African government has been lauded for our approach to this pandemic and our information sharing. But what does the data show when comparing what has been happening in developing countries in areas of medical facilities, readiness to deal with this pandemic, and also things like screening and testing?
Well, I think one of the reasons that South Africa specifically and many countries across the African continent actually came early to the response to COVID-19 in terms of lockdown and other fiscal and monetary measures is exactly because of the weakness, the underlying weaknesses in our health systems. This is the case both for the African continent as well as for Latin America. I would say in the case of Africa, and certainly looking at South Africa, notwithstanding the fact that over the last few days the rate of new cases has increased to above 300, 400, I think coming early into lockdown has certainly helped to flatten the curve, which has been the objective of countries around the world. Just to give time to relatively weak health systems to actually prepare more adequately. Obviously, the trade-offs, and this is across the world, it's more acute in the developing world, is between saving lives and saving livelihoods, and that's the issue around the economies being in lockdown for such a long time, and the fact that both Latin America and Africa have significant informal economies. So that makes the impact of the lockdown much more acute.
And there has, of course, Elizabeth, been quite a bit of concern about the way in which we've approached these lockdowns. Some saying that we, for example, going for a hard lockdown at level 5 was what first world countries and developed economies were doing, as opposed to looking at who we are and our developing economies and the impact that would have on us. Did you guys discuss that at all?
Yes, this came up both in the context of Africa as well as in the context of Latin America. Similar issues around both the economic impact of lockdown as well as the difficulty of social distancing in countries and cities and informal settlements where social distancing is really a problem, where access to water, sanitation is also extremely difficult. The fact of the matter is there are no sort of easy answers and solutions to these problems. Certainly, if you look at the situation in Brazil, where the lockdown where the president has regarded COVID-19 as a sniffle, a little bit of a flu, and has really not taken it seriously, in contrast to many of his governors across states, and indeed some of the people in government, where he goes out and embraces and shakes hands and so on and so forth. The number of cases in Brazil is sitting at over 100,000. This is without sufficient rollout of testing. So one of the points made yesterday was that, in fact, the number of cases might be much, much higher. And you compare that now with the situation in South Africa. In Mexico, for example, also no lockdown. Again, the president hasn't seen it in the same way that African countries have. And there again, the rate is growing. It's sitting at about 26,000 cases already, with about 2,500 or 3,000 fatalities. If this were to accelerate significantly, and this is exactly the challenge that our government faces and other countries in Africa, if it accelerates significantly and you have all of these people having to flock to our hospitals, and we don't have sufficient beds to cater for them, that in itself is going to be a huge tragedy. I think certainly South Africa has tried to put in place over the last 41 days measures to deal with it in terms of additional hospital beds, ventilators, using our manufacturing capacity, as in fact they've also been doing in Mexico and in Nigeria, to build up infrastructure to deal with it. I think it is the case that we now have to begin the process of phasing it down, moving away from the level 5 to level 4 and possibly level 3. But it has to be done very carefully, and it has to be done region by region, depending on where the hotspots are, which is why it's so critical that testing continue, that contact tracing is very much part of the deal, and actually also using, as we have been doing certainly in South Africa and in West Africa and in Latin America, learning from the experiences of, in the South African case, HIV, AIDS, in West Africa, Ebola, in Latin America, Zika. And those responses, I think, have also been useful in how authorities have handled the pandemic.
Now, Elizabeth, the extraordinary scale of this pandemic has prompted comparison to the scope and obviously the rapid spread of the 1918 Spanish flu, which is estimated to have killed about 50 million people. Could those sort of numbers be projected? Could we be facing a similar sort of scene globally from COVID-19?
Firstly, just to say I'm not an epidemiologist, so certainly in terms of projections of those numbers, I think epidemiologists are better able, who are analysing also the way in which the pandemic manifests itself in different countries and the underlying reasons. Certainly the global response, which hasn't always been coordinated within regions, I think has in countries helped to delay the outbreak or the escalation. Certainly Italy, countries like Italy, Spain, the UK and the US are really have been in the eye of the storm, or in the eye of the storm now, and these numbers can certainly accelerate. I think what we're concerned about more generally is that what we do now in terms of flattening the curve, slowing the transmission rate over the next 4 or 5 months is only the first part of a longer term fight against the pandemic. Concerns really around the second wave. In fact, in the case of the Spanish flu in 1918, the second wave that came in towards the end of 1918, beginning of 1919, was much more severe than the first wave of the pandemic. These are all issues that I think the epidemiologists and the medical professionals are grappling with, looking at getting more data, looking at different trends and projections across regions and across countries, but certainly not something that can be sort of ignored. Maybe not in those millions, because I think countries have really taken a number of actions. There is a coordinated response. Certainly, we saw that from the initiative of the European Union a couple of days ago to really accelerate the finding of a vaccine and to be able to roll it out, and also looking at existing medication that might be able to at least limit the severity of cases, and there are also tests being conducted in that sense. But I think everybody is looking at this from the perspective of what happened 100 years ago and trying to take what precautions are possible within the constraints of the socio-economic impacts in many countries to ensure that the worst of that pandemic in 1918, 1919 is not repeated here.
And just a final question, perhaps. Yesterday here on Morning Live, Leanne was interviewing the chair of the Presidential Advisory Committee, Professor Salim Abdul Karim, and trying to establish whether there's validity to the worst fears that countries such as South Africa will be impacted the hardest due to the prevalence of HIV and AIDS. Was there any data that was shared with regard to that specifically, Elizabeth?
No, not specifically. I mean, clearly some of the issues that were discussed briefly relate to the points that we have also been discussing in South Africa around whether the fact that in certain countries there's been historically rollout of BCG in terms of TB and how that might assist. But these are all sort of, uncertainties, and I think the scientific community is exploring all of these options to see whether there might be dimensions that may make it less severe, whether the youthful populations may also help that, but it's unclear. But I think certainly our government and governments across the continent are adopting what they consider a responsible approach to saving lives, while at the same time contributing to the scientific community in terms of their research capacity to see what that might mean, both in terms of vaccines as well as amelioration of the severity of the symptoms, and doing that in a way that understands that our economies have huge informal components, and that one of the points that in fact Brazilian colleague mentioned is that many of the poor in Brazil are saying they will probably end up dying at this rate. They will probably end up dying from hunger first before COVID gets them. And these are all the difficult policy decisions that governments face in an environment where a clear understanding of the pandemic is still being formed, and so decisions are always going to be based on a whole series of information that is incomplete, and that then they build up the knowledge base and move to the next level in terms of decision making.
Thank you so much, SAIIA Chief Executive Officer Elizabeth Sidiropoulos, reflecting on yesterday's webinar discussion on the socio-economic impact of COVID-19.